the purpose, I suppose, of this webinar is to give some of the recommendations about how to involve patient and public advisors within research projects. So we're delighted to have a very experienced panel with us today. We have John Linnell, who is one of our patient advisors here with the Mobilise Consortium. We have Georgia Mills, who is a researcher with the EJS ACT PD group. We have Gretchen McCreary from COPD Foundation based in the US. And then we're going to have the conversation being moderated by Solange Coriel-Roux, who is from AstraZeneca and is also a member of the Mobilise Consortium. My name is Alison Keogh. I'm the Patient and Public Advisory Engagement Lead with Mobilise. So what we're going to do today is I'm going to give a very brief presentation on some of the experiences that we've had within our consortium, and then we're going to open up for a discussion and a question and answer session with our panelists today. So I suppose what we're looking today is take some of the recommendations and the lessons we've learned in terms of engaging patient advisors and embedding their voice within a large research consortium. So what we're doing, I suppose, is looking towards how best to embed the patient voice in research. And this is important for a number of reasons. When we have patient advisors sitting alongside of us and helping to design and interpret research, we naturally create much more meaningful research that is answering the questions that are important to patients. And this is particularly important at the moment, given that we're seeing a shift towards more remote-based trials and trials that have digital components. So because this is a completely new way of doing science, we need to make sure that we have practices and protocols and tools that are in place that are usable, important, and meaningful for the participants that will be involved in this research. So patient, public involvement and engagement essentially means carrying out research with and by members of the public rather than to, about, or for them. So it's effectively making them co-researchers alongside of you. Now, there's 3 levels of PPIE. So there's participation, which is where members of the public or where patient advisors might be participants in a research component. So it may be answering surveys about their opinions or their thoughts, or it might be conducting interviews about lived experiences. But there is, I suppose, a dynamic there where they are participants in that section. Still relevant, but really what we want to do is focus on the involvement component of PPIE work. And this is where patient advisors and members of the public effectively become co-researchers. They advise on protocol development, research design, grant proposals, the interpretation of results, the dissemination of results. So in each stage of the research process, they're giving their thoughts, their opinions, and their experiences on what needs to be done to strengthen this work. And then finally, we have the engagement section, which is where we utilize patient advisors in order to disseminate and share the research components, again, in a way that may be beyond traditional kind of conferences and publications. So things like this webinar, lay summaries, anything that gets the word out there. Again, they have a really important role to play in how that information is shared to make sure that it reaches more people and that it's meaningfully reaching people. However, even though this is a really important area of research, there's very little guidance that exists about how to do it in a really powerful and impactful manner, rather than just something that might be a tick the box sort of situation. So with Mobilise-D, for those of you that don't know the study, it is an IMI funded European project that is looking to develop digital mobility outcome measures of real world walking. And so what we mean by that is there's a very big difference to how we measure people's walking in a laboratory based environment versus the real world. So the real world has other people, it has different weather, different types of surfaces, things that make it much more complex than the type of walking you do in a lab. But the real world is much more likely, or is what people will face in their day-to-day lives. So it's very important, if we're going to measure walking as an indicator of health, that we really try to match what's happening in people's day-to-day lives as much as possible. Now, wearable devices that sit on people's backs or their arms, wrists, anywhere on their body can help us to gather information about people in the real world. So it basically takes the lab and moves it onto people's body so that they can go out and measure their walking in a real world environment. So that's what we've done in Mobilise-D. We've taken the signals that we gain from these wearable devices in order to create outcomes of walking in the real world. So that might be pace, asymmetry, that sort of thing. But what we're looking to do is technically and clinically validate those measures so that we can move forward, putting them into clinical trials in future. But when it comes to engaging with patient advisors, Mobilise-D is actually quite a complex study because it involves 5 different patient cohorts over 34 different research institutions with clinical sites in over 10 countries actually, and 5 consortium objectives. So this is quite a complex study, which means that we have an awful lot of insights to gain from an awful lot of people in an awful lot of places. And so we found this a bit of a struggle initially in terms of really making sure that we were getting everyone's voice heard. So what we ended up doing probably a year or so into the consortium was setting up 2 new groups, a patient and public involvement and engagement board and a patient and public advisory group. So the PPIE board is primarily based includes researchers from the consortium. And the purpose of this group is to implement PPIE activities and I suppose make sure that they're embedded within the work of the consortium. So the purpose was to ensure our action plan is implemented and that it aligns specifically to the research objectives. On the other side, and working very closely and in a continuous feedback with the PPIE board, is our patient and public advisory group. So this is made up of patient advisors from each of our different cohorts, and they help us identify the important aspects, the important questions to ask, and also, as I said, to help us interpret some of the research that we're doing. So these 2 groups were set up in order to work together in this continuous feedback loop where we learn from each other and we take the insights and the expertise from both groups and put it into action. And so here is our patient advisory group. We have John sitting alongside of us today, and we also have an excerpt from one of our other patient advisors that I'll read out at the end. But basically, these people are spread across the world, in the US, all the way over to Israel and everywhere in between. And as I said, they represent each of our patient cohorts, and each of them are involved in different tasks that are interesting to them and that are meaningful to them. So we have these 5 different areas that our patient advisors support us with, and we have different tasks in each of these areas that our PPIE board makes sure that we action. So it might be how best to visualize walking data over time in a way that is meaningful for people. It might be about the value of mobility and really putting that forward in a way that shows how important it is to patients, because that's one of the feedback that we've had from our advisors, is that this typically is an area where they feel clinicians need to understand more of. It might be the importance of how to share their data and what is important around that in terms of privacy. Or we have gained their support in terms of developing questionnaires about how they feel about remote trials and some of the important questions for that. So these are the important topics that relate to the Mobilise-D objectives that are important to our advisory group, and I suppose that work together then to make the work of Mobilise-D stronger. So from doing this work, from setting up those structures, from actioning these subtasks in these different areas, we came together over the last couple of years and developed a paper with our patient advisory group that laid out 12 recommendations from the experiences of the researchers and the patient advisors together. So based on what we've done in Mobilise-D, what would we say other people would need to do to think of this? So this paper is currently under review. We're hoping it might be published soon. And if so, we will have the link to this online. But for the moment, here are our recommendations. So first of all, when engaging with PPIE, it is absolutely integral that we take a consortium-wide approach. So it's not simply enough to have one or two people working on this. This needs to be something that everyone sees the value of, and that everyone thinks, what can I do in my particular subgroup or task that implements PPIE within it? So one of our recommendations is that at the very start, that researchers are educated on the importance and value of PPIE. There is an awful lot of courses that are out there that are freely available that will help researchers in order to identify how to engage with patients and what are some of the tasks that can be done. So we would suggest that this is done from the very start of a consortium. Next, as I said, it needs to be integrated consortium-wide. So what we have done with our PPIE board is make sure that there is a representative from each of our individual work packages, so that they go back to their working group and say, this is what we need to do, and then they feed back to the board. So as I said, it's done across the board, across the consortium, so that it's considered by everybody, and that we make sure that there's a patient component in everything that we do. To help this, we would suggest that people should employ a specific PPIE coordinator that will lead the work. Now, it shouldn't be their role to do everything, but that they oversee the work, they advise people on how to move forward, and they make sure that that integration is happening across the consortium. And that this should be budgeted for in any proposals that are happening as well. And then finally, when we have a plan in process, that we are prepared to iterate it. So research naturally develops, as we know. We hit stumbling blocks. So for us, it was COVID as a big one, and all the implications of that. So what happens when our plans need to change? And I suppose being prepared to iterate that and to learn from the experience and the advice that you get from your patient advisors to change the route that you're taking is an absolutely critical component. Next then, in terms of creating, I suppose, all the structures, what we would have suggested people do is plan for your tasks and your PPIE tasks to be in line with your research objectives. So one of our immediate issues that we had, I suppose, when we were a year in, is we realized that while we were doing PPIE activities, that we were not necessarily making that very obvious, and we were not necessarily mapping that to the research objectives, which meant there was a risk that they weren't going to be meaningful for the work of Mobilise-D. So we would suggest making sure that there's a strategic framework in place that says, this is the components of PPIE that we would like to do, and here's how they map to our research objectives. So it's really clear for everybody why it's being done, and where the impact will lie. We also suggest that resources need to be planned for early. So again, within grant proposals that you recognise, I'm going to need a patient advisory group. I'm probably going to need a group of researchers that help oversee this. And so I need to put in for their time to be able to do that properly, and to budget for that appropriately. We then need to understand, I suppose, what we're asking of our researchers and of our patient advisors. So having terms of reference set up to say, these are the expectations, and this is the scope of what we think will be done, both in the project overall, but also in a PPIE perspective. So as we'll hear from one of our patient advisors, one of our initial struggles was the scope of Mobilise-D was perhaps narrower than some of our patient advisors would have initially liked. So making sure it's really clear from the start, this is what we're able to do, this is what we might like to do in the future, but to get there, this is the work that we need to do, and just making sure that that's really clear to everybody from the start. Next then, in terms of actually developing the patient advisory group and how it operates, one of the things that our patient advisors immediately said from the get-go was that we probably didn't have enough information out there in terms of what Mobilise-D was, that was presented in a way that was manageable for patients to understand, or for members of the public. So they helped us develop a consortium handbook, effectively outlining in lay language summary what Mobilise-D was about and what our plans were. So we developed that alongside of them, but we would suggest in future that that's done at the start. We then have this published on our website. Similar to the terms of reference, we would also suggest, to help make sure we have a safe space where everybody has the opportunity to give their opinion and their experience, that we have agreed code of conducts with your contributors, both researchers and patient advisors. So this could be things like how often they get contacted, what means of communication we use to contact people, and then in meetings, how we conduct ourselves. So are we going to raise hands before we speak? Are we going to put comments in the chat? And this might seem quite formal, but when people are coming together without necessarily knowing each other, often for the first time in research, it's just a nice way to initially set the scene and make sure people know what they are, I suppose, able to do, or what they're being asked to do in terms of the research experience. One thing to be aware of is obviously digital exclusion. So our patient advisors, one of the criteria was that they all needed to be quite comfortable using things like Zoom. Now, the pandemic has probably moved that along quite significantly for a lot of people, but not everybody. And I suppose one of the things that we would suggest to people when planning going forward is that you are aware of that, and to be aware of what we might need to tweak in terms of our own practices to make sure that we have people who are involved who may not be the most digitally comfortable. So that might be making sure that they have someone alongside them who can do the technology work for them. It might be having a family member, something like that, but something that supports them in being involved is really important to be aware of. And then finally, then allowing for flexibility with your membership and invested resources. So with our patient advisors, I suppose we've probably had a pool of around 15 or 16 in total, some of whom have had to step away temporarily due to personal reasons, others who may have had to step away fully because of changes in their health condition. But what we need to do is make sure that the structures are always in place to allow someone new to come in or to leave and come back, depending on what's happening in their lives, in a way that still allows them to feel like they are part of the consortium and able to engage with it when they do feel like coming back. Finally, then, when we're looking at impact, because that's one of the most important things that really shows the value of this work going forward, is evaluating it from multiple stakeholders' perspectives. So one of the reasons that we have developed this list of recommendations is that a year into our PPIE structures, we went out and asked our advisors, how is this going for you? Using an anonymous survey that asked them what's good, what needs to change, what can we do better, and getting their perspective on where they would like to be involved. We've also done this from a research component or perspective as well. So is there something that we need to change going forward, but also then marking and noting everything that's done. So our patient advisors have helped us from everything from co-authoring papers to iterating our lay summary guidelines, to helping us create these webinars, but we have to document everything so that it really shows where their perspective has helped shape the trajectory of Mobilise as it goes forward. And then obviously that we are prepared to refine our work, our research questions, obviously still within scope, but based on some of the feedback that comes from them. So I suppose for us to summarize some of our recommendations are obviously that meaningful and high quality PPIE work takes time, effort, and money. And actually, a lot of our recommendations are based in how you develop your structures. If your structures, your terms of reference, your plans, your objectives are all in place, it then becomes much easier to have an impactful, meaningful patient perspective embedded within your consortium, but it also means that it's much easier to change it because everybody then knows, I suppose, what's expected. So we would suggest taking an awful lot of time to set up those structures and make sure that they're working for everybody involved. There will be challenges with this, but we would also suggest reaching out to groups like ourselves and like some of the other people that will be on our panel discussion next, in order to say, what can I learn from what you've done? People are very open in terms of improving this area and making sure that it develops more. And as I said, measure your impact. It's not always going to be publications. It can be changes to ideas. It can be changes to the wording of some of your outcome measures, protocols, anything and everything. Our patient advisors have gotten involved in every single step of our research process. But we've had to make sure that we really note that, to make sure that we are highlighting the important work and the effort that they're putting in and the impact that it has on Mobilise-D. So just before I open up to the panelists, I just wanted to, I suppose, show one of our other patient advisors' perspectives. They weren't able to join us today, but they did want their kind of story and their experience to be told. And some of the things that they bring up, you can see linked to some of our recommendations, because they've highlighted some of the challenges that they faced as part of this process, but also where they can see it going forward. So this particular person said, when I was first put forward as a candidate for the role of patient advisor, I only had a vague notion of what that meant, but I was generally of the view that patient centricity matters, and so I accepted the challenge. I joined the project rather late and initially had to understand what the original ambition was. So I wondered what the motivation was of some of the sponsors of this seemingly well-funded project. But when I was then asked by a Parkinson's League to give a talk on innovation in Parkinson's, and I took part in a study based on freezing, I realized that the cost involved in generating data of even a small number of patients is really large, and finding a reliable way to generate that data in real life environments has the potential to make studies much more effective and less costly. Given that I was engaging in research for some of the first time, I was keen to validate whether and how I could make a genuine contribution. So to this end, I wrote down my own profile in terms of relevant background and aspirations, and encouraged other advisors to do the same, with the aim being to better understand the mix of experience available around us. I also had to learn what I was able to communicate and how. So I had been keen to blog on the study in order to get the message out, but this was met with some resistance. But yet, with some support of organizations, we can provide ideal communication, engagement, and validation platforms. I think the most significant step in the right direction has, in my view, been the agreement to map some of the symptoms of conditions to the mobility metrics, and particularly by means of personal mobility statements. I've contributed mine as a sample and have volunteered to use this to engage with other people with Parkinson's at the forthcoming World Parkinson's Congress in Barcelona. So that was from our patient advisor, Koen. And as you can see there, he initially struggled with understanding what Mobilise was and how he could engage with that. So that's why some of our recommendations really center on that need to set up really strong structures and to really set out what the scope of a study is and where it may go. Similarly, then, in terms of kind of the terms of reference in how we communicate with each other and with the public is also an area that is really clearly important, so that everybody knows where they fit within the research process and what they can and can't do, obviously, within the scope of the project and I suppose our natural disclosure agreements and things like that exist. So that was Koen's perspective, which he asked me to share. And I've obviously given you the recommendations that we have for Mobilise, but what I'd love to do now is pass over to Solange, who's going to help moderate a discussion between all the panelist members now, so you can get perspectives from the patient perspective, from patient societies, and from other researchers, so that we can, I suppose, widen this conversation a little bit more. Solange?
Thank you so much, Alison. That was great to hear what has been done so far. And this is quite important, not only to hear, what has been done, but also to share widely all this work and recommendation. So you mentioned this paper that is expected to be published soon, but there's a need, of course, to look at what's next with regard to dissemination, knowing that there will be, other European-funded projects. There will be others elsewhere, in the US as well. So clearly, this is quite important to disseminate such information, knowing that more and more these days, it's important to consider patient centricity in drug development, but also as part of a public-private partnership. So this is quite important. And I'm definitely pleased to have been involved in this work and to progress the work. with all these fantastic people that, are part of the PPIE board and the PAG as well. And I would be quite interested to hear from them if there are, some, let's say, comments to share. And in particular, knowing what you have been doing as part of this, as part of Mobilise-D, I'd be interested to hear what they are doing, beyond Mobilise-D. So, John, let us know what you are doing in your advisor role, as a patient representative, not only in the US, but also in Europe.
Oh gosh, I'm involved in so many projects. My problem is I don't know how to say no. But the reason I don't say no is the first time I attended, it was a pharma conference about 8, maybe 9 years ago, and it was billed as being all about patient centricity, because that was the big buzzword, patient centricity. So I attended, and no patients really got to speak at all. So it left me with a very sour taste in my throat. And I thought, well, this patient centricity isn't just a buzzword. And I learned that it's all about the culture in each project or corporation. But it's so important. I mean, what value does the patient bring? Well, often in the past, corporations, pharma, industry, projects would do what they were going to do and then say, hey, let's bring a patient group together and see what they think. You've already opened the barn door and the cows have already escaped. That's a little late. By involving the patient at the beginning, which I am seeing more and more happening now, you're saving time, resources, money, man hours, travel, and it saves everyone money, and it's something that the patient wants rather than doing it on your own and then bringing the patient group together and say, well, this isn't going to help us. This isn't what we wanted. So by being partners in care or partners researching for a cure, whether it's Parkinson's or COPD or whatever, it doesn't matter the disease state. What matters is we're working together, and the patient voice really does matter. And we can get more into that later. Otherwise, I'll take the whole hour, and I don't want to do that.
Well, thank you, John. And indeed, this is quite, interesting, knowing that a lot has been done, and just looking at, what is happening here and there in various, fora. There is more and more, initiatives showing the value of patient involvement, knowing that with patient involvement, developers are quite sure that they will be more successful at the end of the day. And of course, as part of a public-private partnership, of course, you probably remember that there were already, some initiatives that were quite interesting. But it has been quite interesting to see how, this has evolved over the years, knowing that, of course, the patient voice is something quite important for the regulators in their decision making. We had the opportunity last year to organize a multi-stakeholder workshop on digital endpoints. And of course, the patient, they were involved, in this discussion, knowing, as you mentioned, Alison, it's quite important, specifically these days when using digital tools, to have them, being considered, and to hear from them whether the tools that are being used are suitable and they are comfortable with them. So clearly, this is quite important, more and more. And of course, there are lots of activities that are ongoing and where patient could be involved. So Georgia, anything to add on to this? What's your experience so far?
Yeah, so just to echo your original point, Alison, I thought that was a really brilliant presentation, and thank you for all of that great information. I'll definitely be taking some of that back to my project as well. But a similar take really, in that it's so important to involve patients and carers from that very early time point. So in EGS Active PD, our project at the minute is all about designing a trial. We hope to launch it next year. And having the patient and care partners involved from that very early stage has had a huge impact. Because I think often when you're designing research, it's very easy to end up doing things a certain way because that's the way it's always been done, or because you're very focused on, what will make this trial robust and reliable and provide validity. And you can easily forget about other factors, such as what will make this trial actually meaningful for the people that it's being designed for, and what will make them want to take part, and what will make it easy for them to take part. And having that patient involvement from the very start means that you can start incorporating all of those thoughts and that input right from that design point, and make sure that you're designing a trial that is not only robust and reliable, but will mean something to participants, and will hopefully provide results that mean something for them. Because there's no point designing, the perfect trial that ends up with no participants because you haven't incorporated all of those thoughts. And as well, just to add in terms of value, I think we've found that not only have our patient and carer members given us, tons of fantastic input and value related to Parkinson's disease, but patient and care members also come with all of their own knowledge and skill sets that might not necessarily be related to their condition, but are a fantastic addition to the project. We have members with experience in communications and creating podcasts and videos, and experience in trials and biotech themselves. So there's a whole host of extra knowledge and skills that comes along with including patient and care members that adds so much value, I think, to the design process as well.
Thank you, Georgia. So I briefly mentioned that, of course, regulators, are looking into this quite, carefully. And you probably heard that last year, EMA organized a specific workshop on patient experience data, which was the opportunity to bring in this discussion all the stakeholders, including a number of patient representatives. So showing that, the discussion has started, and the next step will be what will be beyond, a simple discussion. So we can expect that there will be more, guidance that, will complement the one that you mentioned, Alison, showing that it will be, of course, quite important to understand how, a patient can be involved in development or in public-private partnership. Important to understand, what could be the impact. And at the end of the day, how, to this data that, could be generated, how, they could be transferred, translated as part of the product information. So this is work ongoing. So I mentioned, the work done by the European Medicines Agency, but a lot of work is being done as well in the US at the FDA. And in the near future, there will be more work done at the global level, since, this is a topic which has reached ICH. So we can expect that there will be in the future ICH guideline. So it's always important to look at the global picture and also to connect all the dots. So this is why all the work you have been doing as part of Mobilise-D is quite important and will bring value to all, not only this initiative, but also for the future. So this is why it's quite important to have you in this discussion, to have you showing the way and co-creating, because co-creation is quite important. So we should be working together and of course at the same level, knowing all your experience and expertise in the domain, and also what you were doing, I would say, outside, knowing all your involvement in different initiatives. So we heard what John was saying. So somewhat, John, you don't know how to say no, but in a way it's good for you, but it's good for us as well, since the opportunity definitely to interact and to be better at developing products and being more successful to deliver important products that will benefit patients. Yes, John, please.
Well, it helps everyone, because like some of the projects I've done, and I do frequently, is doing a critique or edit of lay language summaries or plain language summaries, which are required in Europe and becoming much more common in the US. And somehow, industry and pharma, they have their own vernacular in their own language. And when a scientist, a doctor, a researcher creates what they think is a plain language summary, quite often they're mistaken. And that's where patients can be involved. And you bring a panel together and say, well, no, you can't really say cohort, because somebody at, say, for example, 8th grade reading level will not understand what the word cohort means, even though it's a word that we all frequently use. That's just an example. So utilizing patients in that is very important. But further, take it back to the beginning of the trial or the project, help design the protocol, help edit and design the ICF, the informed consent form, to make it so people understand what they're getting into. In my years of experience, I know that it's incredibly frustrating and expensive to have dropout in a trial. And you're going to have more dropout if the participants don't fully realize what they're getting involved in. And that's where patients can help by formulating words and language that's understandable. And yes, I understand that certain things also have to be in there due to regulatory and legal, but we can still make it understandable. The patient is integral in every single step of the way, from inception of the concept of what the trial is going to be until the very end, through the year after the trial ends, to develop the plain language summary.
Exactly, and thank you so much. I mean, to mention this reminds me of an initiative I was part of some years ago, when we started, an initiative which was, called the Good List Summary Practice Initiative. Something that we initiated as part of the European Forum for Good Clinical Practice, EFGCP, and also EFPIA, the European Trade Association of Pharma Industry. It was a multi-stakeholder initiative, and in the end, we were quite successful, since we had the opportunity to deliver best practice and interacting with the regulators, having them, in this initiative. In the end, the recommendation we drafted, they were, fully endorsed by the regulators. And this best practice document is now, an official European guidance. And indeed, what you said is quite important, John, showing that, the patient, they have to be involved, throughout the process, an end-to-end process. And this is quite, important. So again, another initiative showing how, patient involvement is important. Anyone else to comment and to share experience?
I was just going to say, some of the conversations we've had with researchers recently has been about they understand the value, and they know that this is something that's going to be really important for their work in the future, but they're not necessarily sure about how to recruit patient advisors. So I thought it might be good just to get kind of the perspective of, say, John, how he got involved, Gretchen, some of the maybe the tasks and the ways that you would get link patients and researchers, and then even Georgia, to see how you guys recruited your advisors as well. It would be just great to hear the mix of experiences, I think.
Yeah, well, this is quite an important point, Alison, and showing that there's not only the need to bring in patients, in this work, but also to raise awareness of all the developers and not only industry. So this is why, there's a need as well to raise awareness of all the researchers, including those, from academia. So this is showing, how important it is, to work together. Any additional comment? Gretchen?
Yeah, I just wanted to say, raising awareness with the researchers, I think it's two-pronged, getting them on board with allowing the patient to be at the table with them and showing the value that the patient brings, like John was saying, to the research study from the beginning. But it's also creating confidence and empowering the patient to know that their lived experience does have value, and letting them know it's okay to not be afraid to speak up as needed, because they do have a real impact on research. Research teams work at a really fast pace. Discussion that ensues can be intimidating, full of jargon, it's unfamiliar. So I think helping patients understand the basics of research is essential to helping them not be overwhelmed, so they can bring that lived experience, in a well-rounded way to the research study.
Yeah, well, this is indeed quite a great point, knowing that there's always the need, to build trust and confidence, among all the people that are involved, in drug development or in a public-private partnership. So this is quite important.
Well, and
I think it's also important to train the patient, like as Gretchen was mentioning. You have to, because for example, I'm very cautious and careful when I'm answering a question or saying something, that I'm not talking about me and just how I have COPD and how COPD is affecting me. When I speak, if I'm on a panel, I have to know that I'm representing the entirety, the whole of people suffering with COPD.
Yeah, well, definitely. You mentioned education. This is quite important. And it's not only education of the patient, but it's also education of all the stakeholders, involved in drug development, to show how, important it is to work together. And of course, I cannot resist, to mention another IMI project, EFPIA, which was, quite important, since, that was the opportunity to educate the patient and to have them, becoming patient expert. And it's quite interesting to see that after the completion of this project, sustainability, has been achieved, and EFPIA, is still up and running throughout Europe. And this is why, there are, lots of patient representatives, not only at the European Medicines Agency, but also at the national level, in health authorities. And also more and more these days, they are also part of some discussion around, pricing and reimbursement. So clearly an end-to-end process showing the value of patient involvement.
I think their training element is one of, as you said, Solange, a really important sustainability aspect that's come out of that. which is great to see. I know obviously like Gretchen's based in the US, as is John. You have experience with training programs that are similar, I think. How do you find that they work for your groups? Gretchen?
Are you saying, I'm sorry.
Sorry, your training programs that you have
we created
developed.
the patient.
Yeah.
Yeah, so we got an engagement through PCORI to kind of do something along those lines. And so we started looking, what was out there, reviewing existing materials, and it just kind of illuminated to us that it did not address not only COPD needs, but just patient needs to become, investigators on studies. The majority of these trainings were in person. They didn't account for mobility limitations, once again, not just with COPD, but with others. So once we identified those gaps, we created a patient to investigator training that is 8 modules, and it goes through, just kind of the basics of research, statistics, trying to think, the analysis, the different kinds of documents that they would be reviewing, and one of the biggest ones, building confidence. So we had all of our governing board members, which they are all patients, go through it. This has not been it is online, like it's available for patients to go through now, but we have not really put it out there as much as we want to. That's the plan for this year. But I think it will be a great resource for researchers to come to us. We'll have a pool of trained patients, who will be ready to like sit on what, not just a panel, but as part of the research team. And John went through it, so he could speak to it as well.
Yeah, no, it was very, very informative, very helpful. And I just think as far as, I think one of the questions is how do you recruit patients to be investigators? Patients need to understand they don't need to be a scientist. I haven't taken a science course since junior high, yet my voice is still valid. I'm not a researcher. I'm not a scientist. I'm not a clinician. And I just, if I'm nervous about that, I just state that up front to the panel I'm on at the time, say, I'm a patient. I'm an involved patient, but I'm not a researcher, but I know that my voice will still count. And that puts me at ease, just to make sure they understand that I'm only a patient. And I say only with tongue in cheek, because I'm really the end customer. I'm probably the most important person on the panel, because what they're doing is ultimately for me. And you can't help me if you don't know me. I can't tell you the number of times I've spoken to researchers or scientists. They've never heard a patient's story. They've never met a patient. And how can you help me if you don't know me? You've got to get the patients involved more. And the researchers need to know my story, because that way they have a better understanding of what the heck they're doing and why they're doing it and who they're doing it for.
Yeah, this is indeed quite important. And of course, this is where, multi-stakeholder interaction is important. So you are bringing your experience in the discussion, and the same, for the researcher, the clinician, and also people involved in industry. Knowing, of course, there's always the need to understand what is at stake, what is the research question to be addressed, so that we can discuss together on how best develop, for example, a trial. And of course, with regard to our Mobilise-D project, it was quite important to bring in, as Alison mentioned, all the patients that have, experience in the different therapeutic domain that were in focus. And this is why it was quite important not only to have you, two of them, involved in the work, and also quite interesting to bring in a patient from diverse origins. And this is why it's quite great to have not only people coming from Europe, but also from the US, knowing that when we are developing products, most of the time these are developed for global purpose. So quite important to consider the big picture.
Yeah, I mean, we primarily relied on, I suppose, existing links with people to help recruit our patient advisors. But I know that may not always be the case for some researchers. Giorgio, I don't know how you recruited people in to be your carers and patients. Was it different, or what did you do?
It was a similar method. So we're very lucky to have charity stakeholders heavily involved in the project. So Cure Parkinson's and Parkinson's UK, who obviously have large patient networks that we were able to tap into to recruit our patient and carer members. Although as we were going through the project, we did realise that actually there were certain demographics that weren't as well represented in the project, and we really wanted to increase our diversity to make sure that we were including, a wide range of representation, and weren't missing any, crucial perspectives during the design stage of the trial that would mean that the trial then isn't as applicable or accessible to everyone with Parkinson's. And so one of the things we did is our patient and care members actually flagged this with us. They said some of the discussion points we talk about, we don't feel comfortable that it's only our say involved, because like John mentioned, they're representing the wider Parkinson's population, and they wanted to tap into wider points and wider input from that. So one thing we set up was our wider PPI input group. So this is a group that's kind of separate to the consortium in that they don't join us in working group meetings. It's a much more light touch involvement. But we recruited that group and on the basis that we would send them different ways to add input to the project. It might be an online survey or some short answer questions. It might be a request to get involved in focus groups that we're hoping to run later on in the year. But essentially they're a contact list that we can send this out for a rapid response. It's completely up to them if they respond or not, but it just means that we have quick access to a much larger network in addition to our PPIE working group members. So we can use that to feed into discussions where they don't feel that they are quite representative of the wider population. So of course, you're never going to be a representative of every single person's opinion, but it adds some extra input there. And then we've also set up a community advisory panel, which we will be launching in a few weeks' time. And this was a panel that we hope will provide diverse representation for people of different ethnicities, different cultural backgrounds, different socioeconomic backgrounds, and different geographic locations. And that group will involve participants who have experience of a chronic illness, not necessarily just Parkinson's, because they'll be able to give us input from different perspectives that we're currently missing, based on accessibility and how we can make the trial as accessible as possible for people from a range of backgrounds. And so we're hoping that we are, gradually covering these wider perspectives and all of the representation that we can to include this in the trial. But I think it is really a learning curve, especially with recruitment and trying to get recruitment from people of different backgrounds. For that community advisory panel, we recruited in a slightly different way. We used the NHR Take Part in Research website, which was a different pool of people and gave us a really great diverse group of applicants for that as well. So I think it's been kind of learning as we go through the best way to set things up and understanding, okay, what are we missing and how can we overcome that and kind of fill that gap.
Yeah, you don't have to have all the answers to start with, but it's about
yeah, this is quite interesting. And of course, knowing what you just said, it will be quite important, of course, to share widely this learning which will nicely complement, of course, the best practices that have been identified through the work done by Mobilise-D. So this is quite important, and I'm sure that there will be more to come in the future, which will help everyone involved in drug development to understand how it can be done to have patient involved, and to show them the value of it, and also showing that what is being done, what is being developed will be meaningful to the patient as well. So showing that we can be successful altogether. And I remember that knowing COPD is quite, something close to my heart, being, of course, a pulmonologist by training. I remember also the work, we did as part of another public-private partnership under IMI, which was proactive in COPD, where we developed and qualified a patient-reported outcome to assess COPD patient perception of physical activity. And at that time, I remember we worked with patient organization as well. And since then, lots of work, has been done showing that we've learned a lot. And this is definitely the opportunity to share all this learning and to have all these lessons learned be widely shared, so that this will benefit all involved, not only in drug development, but also in future public-private partnership. So with that said, I'm just wondering whether if the people that are joining this webinar may have any question. No, if not, I think we have to come to a close. But I'm sure that we will have other opportunities to, not only keep the momentum. And I'd like to definitely thank, all our panelists. You are so great, and this is so fantastic to interact with you, and I'm definitely looking forward to working with you further, knowing that the project, the Mobilise-D project, is not yet completed, and there will be still time to move this forward all together. Thank you so much. Any last comment from you guys?
I'll just close with my pet phrase. If it's without us, it's not about us.
Amen.
That is great. Thank you. And again, thanks, Alison, for the nice presentation you gave, initially. And of course, we will make sure to share with all of you the paper once, finally published, which is, as you were saying, a joint work, a joint effort, as you will see quite soon. Thank you so much.
Thank you, all of you. On behalf of Mara and Mobilise as such, I want to thank all of you, speakers and panelists, and everybody who joined online for this webinar this afternoon. I wish you all a very good evening. Bye-bye.
Thank you again. Bye-bye. And of course, let's keep the momentum, since, more to come in the near future. Thank you so much. Bye-bye.